All right. Good evening. My name is Russell Tippin. I'm the President and CEO of Medical Center Health System. Thank you for being here tonight. Even though it's late in the evening, we appreciate y'all being here and everybody we have up here with us. We have some news we will need to report tonight, but before we get started in that, I just want to take a quick minute, first of all, to thank all of our leaders, all our city leaders, all our county leaders, and everybody that's been involved in our process in this community to get ready for where we are today in our nation and where we are in Odessa and Ector County. I also want to take a minute. I wouldn't be doing my duty if I didn't call for a time for everybody in this community to take a second tonight to pray for each other, to pray for us as a hospital, to pray for us as a community and as a nation. I ask for your prayers for me as the leader of this hospital, for all our nurses and doctors and our judges, and that if you think you've prayed enough, say one more, because as we move forward, we need that. We need the peace, we need the strength, and we need the help of our Lord above to get us all through this and just to get this process moving. So if you're hearing my voice tonight, please say an extra prayer for us and our team at Medical Center, for our friends down the street at Odessa Regional, for everybody that's going to be involved in it, which is everybody in this nation. So please take time to do that. All right, so we're here tonight because Medical Center, we do have to report our two first positive cases of the COVID-19. We have those confirmed, two here in the hospital. I can tell you that these two patients, one is a 58-year-old male and one is a 55-year-old female. They have both been in our hospital in proper areas for about 3 days as patients, so we've had them in the building. They have been in our areas that we have set up for these type of patients, so our staff have been aware that these are persons of suspect and that we have taken the necessary precautions to protect our staff and to get these people treated. But these two are confirmed, so those are our first two at Medical Center. And I'm kind of glad that we've got these going so we can move past this point and get into the treatment of our patients and start focusing on recovery for our community and for our patients. I will tell you that as of right now, that just at Medical Center we have tested 39 patients. 14 of those are pending approval from the health department to go up to the state, so those are in pending process, and 11 more are waiting on result. So we have, I wanted to give you those numbers. I know that's a hot topic, but I wanted to give you those to let you know that those are in process. We have seen a ramp up in testing this weekend, and so as this process goes through, we'll have more numbers to give out as those become available, but we just wanted to report those. I think the main situation we wanted to report tonight and that we wanted to convey tonight is that at Medical Center we are ready for this. We have been ready. We've had teams that have been meeting for weeks. If y'all remember, our first get-together was about a month ago, and we have been prepared, and we are prepared. We have isolated floors to put these patients on. We have upstaffed our nurses and doctors and housekeepers and got them ready for this. We have equipment ready to go, and so we are ready. We have many contingency plans in place. Should one of our units fill up, we're ready to go to the next one. And if that one fills up, we're ready to go to the next one. So our contingency plans are good. They're ready. We talk about these every day. Our health emergency management team is meeting every day, has been for about 2 or 3 weeks. So we are ready for this. And the plans are in motion, and they'll stay in motion until we get through this part of this virus. But our crew's ready, and we are going to be very proud and are proud of them and the work they're doing and the care that they're going to be able to provide. I just can't stress enough about our contingency plans. They're ready. They're already in motion, and so I just feel like we're ready to step up and really knock this out of the park. I want to talk to our community for a minute just about test, and if you're not feeling good, where do you go? We're trying to keep that emergency room free of non-emergent patients. When I say non-emergent, if you're having trouble breathing, you have some chest pain, to me that's probably emergent. If you're not, that's non-emergent. And we're trying to drive those into our urgent care clinics to make sure that our emergency room is available for true emergency patients. We have urgent care centers all over town. You can go there, you can get in front of a doctor and a provider and get that situation handled. But at the same time, we really want to focus on keeping that ER open for true emergencies, okay? And I want to get that out there to our community. We want to take care of you. Everybody wants to take care of our community. We just want to drive those patients to the proper location so that way we can keep the emergency room open for true emergencies. Now, I know some people are going to say, hey, if it's me, it's an emergency no matter what. We understand that. We all feel that. But we want to make sure that our true emergents are going to get the care they need. If you're having what you think are symptoms of this, we can direct you to our urgent care clinics to get taken care of there. We just want to make sure that avenue stays open. We are following the CDC guidelines. That's something that gets talked about a lot, is CDC and their guidelines, and those are changing rapidly. But we've been working within the hospital, with our other hospital, with Odessa Regional, with the county, with the city, to make sure that we're all following the CDC guidelines, so that way we can stay in our lane and make sure that we're using our assets the best way we can, and that's to follow the CDC guidelines. So we're working with that. Some of y'all were at our meeting the other day where we got some approval to get some more equipment in. We're just trying to be prepared. Should this thing just really blow up on us, we'll have things in place to protect our staff and our doctors, just to make sure that we're here to take care of you. But at the same time, those CDC guidelines are very important. They're not easy to understand. The good news is we have people that are much smarter than me that can handle those and can interpret those and give us good direction to get those done. But overall, our medical center staff is ready. They've done a great job to be prepared. I'll tell you, they're nervous. We're all nervous about this. But at the same time, we work with a bunch of professional folks that want to do what's right and wants to take care of our patients. So with that being said, I would take any questions you might have. If you have a question that I can't answer, I'll probably turn it over to Kristen. She's our Chief Nursing Officer. And by the way, let me take a second just to introduce everybody we have up here. So if you want to, I'll start with Dr. Davenport. If you want to just your name and what you do here, and we'll just go down the line.
Don Davenport, I'm General Surgeon. I am currently the Chief of Staff and Interim Chief Medical Officer.
Tim Benton, I'm a family medicine physician. I am Vice Chief of Staff and also Interim CMO, Chief Medical Officer.
Thank you.
Kristen Timmons, Chief Nursing Officer.
Brandy Garcia, the Ector County Health Director. Debbie Hayes, Ector County Judge.
All right. Thank you. Thank y'all.
Tippin,
Yes, sir.
The two new cases, just to be clear, these are separate from the cases that Ector County confirmed today?
These are two new cases today. That's right.
The total count to 5 cases in Ector County.
I believe that's correct.
That's correct.
Yes, sir.
Also, these patients, what does their treatment look like at this time? I know there's no vaccine or no cure for the COVID-19. What does the treatment look like? How are you taking care of them? And what kind of conditions are they in at this time? Critical, severe?
Yeah, let me punt that to Kristen. Do you want to take a stab at that one?
Sure. One of those is in critical condition, and the other one is in stable condition, and we're just have them in proper isolation and following the treatment plans that the physicians have derived at this point.
Okay, and just to be clear, you mentioned that we do have more. You have more tests. You branched up testing. How many tests do you have available, and who are you testing at this time? Yeah,
you know, the number of tests available. You know, you start putting those numbers out there, then people start. I mean, they can just get that information totally, just totally messed up. So we have adequate testing. How does that sound? We have enough testing. I mean, we've always have been ready for this influx. The testing is available. Who are we testing now are the people that meet the guidelines, the checklist, really from the CDC. You know, things like, have you traveled out of the country? Have you been directly exposed? There's a checklist to go through, and those are the ones that will qualify for the testing. So, of course, anybody our physicians feel like need to be tested, we can test those too. So we're ready.
Thank you, sir.
Yes, sir.
Yeah. And just on that note, I know you said, I think you had 11 tests that were waiting results. Do you have a timeline as to when you guys might be able to get those results?
Yeah, I can tell you that's not soon enough, right? I mean, it seems like the more people are testing, the longer it's delaying the test results. I think right now a fair time to say is probably 7 to 10 days it takes to turn those around. So some people say we can have them in 24 hours, we can have them in 4 days. It just depends on where they fall when they come into the testing center. But I think it's safe to say probably 7 days to 10 days is fair enough to put that number on it. Yes, ma'am.
The CDC guidelines ultimately leave it up to local governments to decide who gets tested. Why are so few people being tested?
Yeah, you know, that question is blown up all over the place, is why so many few. I mean, people are using the word few. I can tell you, I believe that this community has done a good job working together, everybody staying in their lane and trying to follow those CDC guidelines. Now, those are changing. I mean, what the guidelines were the first day are not the same as they are today. But you got to think about this too. We want to make sure there's enough kits for everybody. If you use them all up at one time, there's none to test at a later date. But at the same time, we're following the guidelines, and I think we've all done a good job using those to make sure we're getting the right people tested.
Are these two confirmed cases travel related?
I don't.
No, at this point, we know that they were exposed within our community. They live in our community, and they told us upon admission that they had not traveled.
So those are right here in Ector County. So they're not travel exposed.
How quickly after being symptomatic were they admitted to the hospital?
I would say they were admitted pretty darn quick. They went through our protocol, went through our screening process. Once they reached the level that we knew they needed to be admission and to be held here and watched closely because of their condition, that probably happened within a matter of hours.
Since this happened in our area, are you guys expecting for more cases to pop up?
Well, I think the cases have always been here. I mean, even when test results, when Ector County had none, I think it would be probably pretty ignorant of us all not to think that it was in Odessa. But isn't it funny? As soon as you get one, bam, suddenly you've got 7. Bam, suddenly you've got 20. I know our friends in Lubbock have gone from very few to like 50 now. So, I mean, I think the answer is you can expect to see more come as this goes on. I think you'll see more. And I think we all should think it's around us all the time. I think you should live that way, to think that if you're out there, you're being exposed. I think that's probably a fair statement. What else?
Ms. Hayes, we know that Mayor Turner plans on putting a shelter in place in the city of Odessa. Do you plan on doing the same thing with Ector County?
I do. I think it's very important to show unity between the city and the county, and it's very hard for our law enforcement and for our citizens to realize what is really in place when you're on one side of the line, being the city, and you cross the line and then you're in the country. And one of the issues that we've really had a hard time getting a handle on are the game rooms. And we have those both in the city and the county. And you and I both know that that has been a lot of call-ins and questions that the people have. And so it's going to be necessary for us to go ahead and put some language together that mirrors the city and show unity between the two. And that will be done tomorrow.
Yes, ma'am.
Judge?
Yes.
What does the shelter in place mean to residents? What can they do and what can't they do?
You know, I hate to do this to you, but it's a long list of things that you can do, and it's a long list of things you can't do. And so, unfortunately, I don't have that memorized. So, if you'll just give me a pass on that one, that we will be glad to make sure that we go through that tomorrow at a press conference when we do that.
So there will be a press conference regarding that?
Yes. Mm-hmm.
Yes, sir.
If you don't mind, please, the person answering, if they could step up to the podium, please.
No problem.
I'm sorry.
All right. Any other questions or comments for the healthcare for us?
Yes. Can you talk to me a little bit about the prevention protocols?
About
The prevention protocols.
the prevention protocols?
Yes, please.
You look like a prevention protocol
Prevention.
expert.
The same as what we've been sharing: washing your hands, staying indoors as directed, staying 6 feet apart, which we are obviously in violation of. Those are the most important things. And if you are sick, go to those primary care providers. We have multiple within our communities. Our urgent cares are all geared up to take care of those patients. If you're coughing, if you're running a fever greater than 100.4, if you've been exposed or you're in question, please go to your primary care physician. They will screen you and then determine whether or not they need to do further testing.
Thank you. Scoot over. The social distancing, I think, is important. I think that the data is showing that does work. I think we can see that even in our own community. I know if you go to some stores, you can't see that. I think the mayor and the county judge's declaration that are coming forward will help work with that, and I think our stores should work with our community leaders to make sure we're doing what's best for our community. But the social distancing is a big one. One other thing I'd like to add, I'd like to spend just 1 second, if I can, to send a word of encouragement to our friends at Odessa Regional. They've been busting this since Friday. We know they had their first case, and we want you guys to know we're thinking about y'all and praying for y'all too, that we're in this together, and that that this community is truly blessed to have two health care leaders in this community. And to those folks at a regional, hang tough, keep doing what you do, and take care of your patients. And we want you to know that Medical Center sends our support to you guys.
Can you give an update again on the two patients for people that maybe weren't here at the beginning of the Facebook?
Yes, sir. The two patients, the positive we have, are both from Ector County. They're both have been in our hospital for approximately 3 days, a 58-year-old male and a 55-year-old female. And both of those have tested, and they are confirmed positive for COVID-19 at Medical Center Hospital.
And I'm sorry, sir, my last question. Earlier today, Sheriff Griffiths confirmed that 2 of his deputies are self-quarantining. Are those deputies part of the pending test that we're waiting results on?
That is a great question. I don't know that. I don't know if they were tested here, if they went through a private lab. So I'm glad they're tested. I can't confirm or not confirm that those were done here.
Thanks, sir.
We have some people actually asking if they have to stay home.
Yeah, my advice to people would be to stay home. I mean, that's what's coming from our president. That's what's coming from our governor. That's what's coming from our local leaders. If you can stay home, that's the best place to be, is to stay home. Hunker down, turn on your Netflix, watch some miniseries, whatever you can do. Oh man, and just stay home, and that's the best way to try to get this under control and flatten that curve.
And then I think Krista might be able to answer this. Should if the nurses that are treating these patients that are currently confirmed positive, what are some of the directives that you or anybody else is giving them, whether they should go home or whether they're being quarantined, or what's going on with them?
So we have procedures in place, and what we did was we said if you are not comfortable going home, we have arranged a place for them to sleep here. We have showers for them. They're getting their extra scrubs. All of them keep those in their lockers so that they don't even have to leave the building if they choose not to. But we do properly train our staff in how to don the appropriate PPE and how to take it off. So that they are all very comfortable in knowing that when they leave a patient's room, they are leaving the bugs in the room. And then, of course, doing their proper hand hygiene. But if they don't want to go home, we're not asking them to. We are providing that for them.
Hey, Christine, I'm sorry. Just to be clear, I'm not sure of the proper terminology, but PPE, the uniform or whatever it is that they're wearing when they're treating these patients, I'm guessing is a large upgrade from what they would generally wear in a normal circumstance.
It is. One of those things we do is you've got your mask, your gloves, your goggles, you have a gown on. Several of them are wearing their hat protective covers so that every piece of their body is completely covered when they go into those rooms. And some of our physicians actually have the plastic suits that they wear as well.
Thank you.
And that's also been a big part, is these ladies and gentlemen out there that have been making these masks for us. Thank you again. Thank you for what you're doing. Keep sewing them, because we're going to need them. It's providing a good resource for our folks, and those people at that level of exposure are able to wear those, and it's been a big help for us. So for those who did that, for Dr. Armstrong, who in our building kind of got out in front of that, thank you for that, and all the church ladies and everybody sewing, thank you, and keep them coming. Yes, sir.
Regarding the masks, are they asking for donations to buy materials or anything like that?
Yeah, I mean, I think we'll take whatever we can get right now, and I think that's not just for us. That's probably for any facility in this area that There's a limited number. We're all working to work many angles to get more, but if we can find supplies to manufacture those, these ladies sewing them, washing them, ironing them, bringing them to us, bring them on, because we'll find a place to use them.
Where can someone that wants to donate, where can they bring their money to or make a contribution?
Yep. United Way is one. The Medical Center Foundation is we're running some through there too. So if they want to reach out to our foundation, they're set up to be able to do that and give the proper paperwork so they can all that can be done. But man, come on, bring it. We'll take it.
Through the emergency management plan, the United Way is the party that is designated as the nonprofit to help with a lot of those donations that come in through our community, and that's who it's through.
All right.
I have two last questions. Can you tell us how many presumptive positive cases we have?
Presumptive positive cases. Anybody want to?
So those are the numbers that he read earlier. So we have 14 that are pending approval to be sent off, and we have 11 that have already been sent off, and we're waiting on their results.
Another question. What are the steps the tests go through once they leave the hospital?
Yeah, the test, once they're collected here, there's some legwork that goes on behind the scenes even before that happens. Then it depends on which way it goes. If we send it through the health department and through the state's lab, there's a process through there to make sure they meet the criteria. We get a tracking number, we get an ID number, then it gets approved off, and off it goes. Through the private labs, it gets approved by a doctor with a doctor's order, it gets collected, we ship that off, and then it goes to that lab. So either way you go, there's steps for both of those. So through the state level, there's a few more steps because there's better tracking, and you can imagine the amount of tests they're getting, what they're having to do to keep up with those and to keep those going to the right place. So there are more steps through there, but they're all appropriate, and that helps us keep good records of who's getting tested and who's positive and who's negative.
And I'm sorry, sir, very last question.
You said that was your last one a minute ago.
Just to put minds at ease, any patient that tests positive for the coronavirus, are they being released back at home if they are, let's say, in dealing with it in a healthy way and seem to be able to get over the virus themselves? Are they asked to self-quarantine at home, or are they all just kept in if they are positive, do you anticipate anybody leaving this hospital until they are no longer symptomatic?
Yeah, I know that there are positive people that are at home right now. I know that. And that's not just here, but that's all over the world, the United States. And I think that that's proper, because if they are able to handle this at home and they're able to treat themselves, that's one less bed being taken up for somebody who is more emergent that person's not filling. So I know that there are positive cases at home. There are people who don't even know they're positive. They're taking care of themselves at home. So I would say, yes, that is happening. And they're not going to get released from the hospital till our doctors say they're ready to go. But at the same time, we want to make sure we have enough beds for people who are sicker and that need that spot. So there are people that are managing themselves at home.
Sorry, adding to that, what determines when a person is in severe condition? Like, do you guys have?
Wow, that is probably out of my pay scale. Anybody want to answer that?
I'll let Dr. Benton speak to that.
Okay, great.
So we bring them to the hospital when they're no longer able to care for themselves at home. That may be like oxygen requirement, or if they need additional support, maybe intravenous fluids, things like that. But if they're otherwise stable, they can care for themselves at home.
What's the follow-up after someone is discharged from the hospital?
A follow-up like when we tell them to come back?
Make sure if they're not contagious or...
Sure. So yeah, we would, their primary care physician would reach out to them, hopefully keep track of them, but also we would see them back in our offices at appropriate times.
And that's mandatory, right, for that?
We would keep track of them, and they will also be tracked through the health department as well.
Thank you, Dr. Benton. All right. Anything else? Have we got everything covered we think we need to cover? Are y'all okay? Docs, y'all okay? Just again, we just want our community to know that we're ready. We've been ready. If our ready's not ready, our contingency's ready. We've have things in place and have had them there for a while, and we're ready to attack this head on, and we'll take care of the patients. Again, to our community, stay home, wash your hands, be careful, assume that you are going to be exposed, and stay home and take care of yourself. And again, don't forget to pray for your neighbors, pray for us, and pray for this community. If nobody has any questions, we'll wrap it up. Anybody else? All right, thank you. Have a great evening.